Hello, I'm Dr. Musso and today's topic is degenerative disc disease. Degenerative disc disease is a physiological process that the intervertebral disc can undergo. It's a degenerative type of disc damage. The disc has a shock absorber function between the vertebral bodies and it's mainly composed of water. Its degeneration therefore involves a load of water that becomes less and less, making the disc increasingly dry, until its complete dehydration and consequent disappearance. There are several studies and theories on how to intervene in case of degenerative disc disease, but to date the evolution of this disease is classified mainly according to Pfirrmann criteria. This classification relates to degenerative disc damage, called DDD spine, and indicates the extent of the damage according to a graduated scale that assigns a score from 1 to 5. With a score that is placed between Pfirrmann first and second degree, less invasive surgery can be considered, via microdiscectomy or endoscopy. From the third to the fifth Pfirrmann degree it's probably necessary to resort to a more invasive surgery of decompression and arthrodesis, which can be posterior, lateral or anterior depending on the patient's needs, also restoring the values of lordosis curvature of the lumbosacral spine. In this type of surgery, the disc must be replaced with grafts filled with bone dust that restore stability and height, restoring the distance between the two vertebral bodies. Before facing the most invasive surgery, however, it's necessary to evaluate the following aspects by magnetic resonance imaging. Whether or not osteochondrosis is present, or Modick's sign, of which the first degree is important since it indicates the presence of edema of the spongy bone adjacent to the degenerated disc, and it's therefore a sign of microinstability. Evaluate the paravertebral muscle component, which is often invaded by the classic fibroadipose degeneration of the degenerative disease. Evaluate the iliopsoas bilaterally, which is often hypertrophic, as opposed to the paravertebral musculature. The muscular evaluation ensures that any surgical act can later be accompanied by the correct rehabilitation of reinforcement, recovery and progressive load of the spine. It's necessary to make a correct diagnosis of the disease, because unfortunately in many cases the pathology is treated as a herniated disc, but in reality it's a degenerated disc of the 4th or 5th degree of Pfirrmann, thus causing recurrence. See you soon.